I have to be honest with you today, and I mean really honest. The kind of honest your own doctor might not be with you. Because what I'm about to tell you goes against everything you've been told. Every year, millions of Americans over 65 walk into their doctor's office, get certain tests done, and walk out thinking they are being safe. They think they are being responsible. They think they are protecting their health. But what if some of those tests are actually doing more harm than good? What if some of those tests are leading to unnecessary surgeries, dangerous treatments, and life-altering side effects for conditions that would have never hurt you in the first place? I am a doctor. I have seen this happen, not once, not twice, thousands of times. And today I'm going to tell you which 5 medical checkups I personally would never get after the age of 65, and more importantly, why. Stay with me through every single word of this, because by the end, you will have information that could protect you, protect your husband or wife, protect your mother or father from real harm. Let me start with something your doctor may never say to you. Medicine is not perfect. Tests are not perfect. And after 65, your body is not the same as it was at 35. That changes everything. A test that saves a 45-year-old's life can destroy a 75-year-old's quality of life. That is the truth. And that truth is what we are going to talk about today. Let's start with the first one. Annual full-body CT scans. You may have seen advertisements for these. You may have even paid for one out of pocket at one of those scanning clinics at the mall or near your local hospital. They promise you peace of mind. They tell you this scan will find anything hiding inside your body before it becomes a problem. It sounds wonderful. It sounds responsible. And if you love your family, why wouldn't you want to catch something early? Here is what they don't tell you. A full-body CT scan exposes you to radiation. Not a tiny amount. According to the American College of Radiology, a single full-body CT scan delivers radiation equivalent to roughly 100 to 500 chest X-rays. Now, for most younger people, that radiation risk is still outweighed by the benefit of catching something serious. But after 65, your body's cells respond differently to radiation. Your risk of radiation-induced cancer actually increases as you age, because your cell's ability to repair radiation damage slows down. This is confirmed by research published in the New England Journal of Medicine and supported by the National Cancer Institute. But the radiation is only part of the problem. The bigger issue is what happens after the scan, because here is what these full-body scans almost always find. Something, a spot, a shadow, a small abnormality, in your lungs, in your liver, in your kidneys. And the overwhelming majority of these findings, medical studies show up to 86% of incidental findings in CT scans are completely harmless. They are things that have been sitting in your body for decades and will never hurt you. They are called incidentalomas by doctors. They are basically non-events. But when your scan comes back with one of these findings, what do you think happens next? More tests, biopsies, follow-up scans, specialist visits, and sometimes surgery. Surgery on people over 65 carries significantly higher risks, longer recovery, higher chance of complications, greater anesthesia risk. And all of this for something that was never going to harm you. The Mayo Clinic, the American Cancer Society, and the U.S. Preventive Services Task Force all advise against routine full-body CT scans for people without specific symptoms. Please, before you book one of these, talk to a doctor who knows your full health history, not just a scanning clinic trying to sell you peace of mind. Stay with me, because the next one surprises almost everyone. The second checkup I'd never get after 65 is routine PSA screening for men who have no symptoms and are over 75. Now I want to be very careful here. PSA tests have saved lives. I am not saying they are useless, but there is a specific situation where this test causes far more harm than good. And that situation is older men, especially men over 75, who have no symptoms of prostate problems whatsoever. The PSA test measures a protein in your blood that can signal prostate cancer. Sounds like something you always want to know, right? But here's the reality that major medical organizations, including the American Urological Association and the U.S. Preventive Services Task Force, have been saying for years. Prostate cancer in older men is frequently what doctors call clinically insignificant, meaning the cancer grows so slowly that statistically something else will become a problem for you long before that prostate cancer ever does. Many men over 75 die with prostate cancer, not from it. Studies have shown that over 50% of men who die from other causes in their 70s and 80s have undetected prostate cancer when examined after death, cancer they never knew about, and that never affected their lives. But when a PSA test comes back elevated, and after 65, PSA levels naturally tend to rise even without cancer, men are sent down a path of biopsies, anxiety, and often treatment. And prostate cancer treatment is not gentle. Radiation therapy, surgery, and hormone therapy can lead to urinary incontinence, sexual dysfunction, and serious fatigue that dramatically reduces quality of life. For a cancer that may have never caused a single symptom, I have sat with patients who went through all of that. Men who spent their final years dealing with the side effects of treating something that was never going to kill them. The conversation about whether to screen must happen between you and your doctor, with your full health picture on the table, not as a routine checkbox on a standard form. Now let's talk about the third one. And this one is particularly important for women. Routine mammograms for women over 75 who have no specific risk factors. I know this is going to be hard to hear. For decades, we have told women that annual mammograms save lives. And they do, for women in their 40s, 50s, and into their early 70s, with appropriate risk factors. The evidence for that age group is solid. But after 75, the picture becomes much more complicated. And most doctors simply don't have enough time in a routine appointment to explain why. Here is the honest truth. Breast cancers found in women over 75 tend to grow more slowly. Most breast cancers found in older women are what doctors call low-grade tumors that may take 10 to 15 years to cause any serious problem. A landmark study published in the Annals of Internal Medicine found that a significant portion of breast cancers detected by screening mammograms in older women would never have caused symptoms or death if they had never been found. But once they are found, the medical system almost always treats them. Surgery, radiation, chemotherapy. These treatments are brutal at any age. After 75, they carry dramatically higher risks of serious complications, heart problems from radiation, immune system damage from chemotherapy, post-surgical complications. Then this is not a small issue. The American Geriatric Society and many leading oncologists now recommend that mammogram decisions for women over 75 should be individualized based on overall health, life expectancy, and personal values, not just automatically continued as a yearly routine. If you are over 75, healthy, and have specific risk factors like a strong family history or prior abnormal results, talk openly with your doctor about whether the math of benefits versus risks makes sense for you. That conversation is your right. Don't let anyone skip it. Now, the fourth checkup I would never get after 65 in most cases is aggressive cholesterol management with repeated advanced lipid panels, when you're already on stable medication and feeling fine. I want to explain this carefully. Managing cholesterol is important. If you have heart disease, or you've had a heart attack, careful monitoring of your cholesterol is absolutely essential. I am not telling you to ignore your heart health. What I am saying is different. There is a trend in medicine right now where patients, especially older patients, are getting repeated, highly advanced lipid panels, sometimes multiple times a year, even when their cholesterol is stable and their medication is working. These advanced panels look at things like LDL particle size, LPA levels, and APB measurements. For most seniors on stable, working statin therapy with no new symptoms, repeatedly ordering these expensive, anxiety-producing tests adds very little value and very often leads to medication changes that weren't necessary. Here's why this matters for seniors specifically. Statins are powerful medications. In older adults, particularly those over 75 without a history of cardiovascular disease, the benefit of statin therapy is actually less clear than it is in middle-aged patients. Multiple studies, including analysis from the Cochrane database, have shown that statin therapy for primary prevention, meaning preventing a first heart attack in someone who has never had one, in people over 75 shows much weaker evidence of benefit and greater risk of side effects, including muscle pain, weakness, memory issues, and increased fall risk. Falls in seniors are one of the leading causes of serious injury and death. A medication that increases your fall risk, started or continued based on a test result that wasn't clearly needed, is a real danger. The question is not whether cholesterol matters. The question is whether repeated aggressive testing and escalating treatment in stable older patients improves lives or simply generates more medical intervention and more risk. Ask your doctor directly, is this test changing what you recommend for me? And if not, do we really need to repeat it this soon? Stay right here with me, because the fifth one is something almost nobody talks about. The fifth medical checkup I would never get after 65 without very careful thought is routine colonoscopy screening past the age of 75 in people who have had normal prior screenings. Now again, I want to be absolutely clear. Colonoscopies save lives. For people between 45 and 75, screening colonoscopy is one of the most powerful tools we have to catch colorectal cancer early. I am not asking you to skip this if you are in that range or if you have never had one or if you have specific risk factors. What I am talking about is something specific. Seniors who have already had multiple normal colonoscopies over the years being sent for repeat screenings well into their 70s and 80s, essentially on autopilot, without a real conversation about whether it still makes sense for them. Colonoscopies are not small procedures. They require bowel prep, which for older adults with kidney disease, heart issues, or dehydration problems can be genuinely dangerous. The procedure itself carries a small but real risk of perforation, a tear in the colon wall, and that risk increases with age. Recovery is harder. Sedation affects older patients differently. Complications like bleeding, infection, and adverse reactions to anesthesia are more common after 65 and especially after 75. The U.S. Preventive Services Task Force now states that the decision to screen for colorectal cancer in adults aged 76 to 85 should be an individual one, made by the patient and doctor together, weighing overall health and prior screening history. For adults over 85, they recommend against routine screening. Why? Because the time it takes for a polyp to become cancer, usually 10 to 15 years, means that for many patients in their late 70s and 80s, finding a small polyp today does not translate into a meaningful benefit for their remaining years of life. But the risks of the procedure are immediate and real. If your last few colonoscopies were completely normal, if you have no family history of colorectal cancer, and if you are over 75, please have an honest conversation with your doctor about whether the next one is truly in your best interest. Don't just go because it's time, ask the question. Your doctor should welcome it. Now I want to talk to you for a moment about something bigger, because the real message behind everything I've told you today isn't that tests are bad. It isn't that doctors are wrong. The real message is this. After 65, you have earned the right to be a partner in your own healthcare, not just a patient who follows instructions without asking why. The medical system is very good at giving you more tests, more scans, more procedures. It is less good at stopping and asking whether more is actually better for you at this point in your life. That job sometimes falls to you. There is a concept in medicine called overdiagnosis, finding things that wouldn't have harmed you, then treating them anyway. A landmark report in JAMA Internal Medicine estimated that tens of billions of dollars are spent every year in the United States on healthcare that does not improve outcomes. And much of that is concentrated in tests and procedures done in older adults. This isn't about money. This is about your time, your comfort, your quality of life. Because every unnecessary test you go through, every biopsy, every follow-up scan, every surgery for something that wasn't going to hurt you, takes something from you. Time, energy, peace, strength. And at 65, 70, 75, those things matter enormously. I want you to go to your doctor after watching this, but I want you to go differently than you used to. I want you to go ready to ask questions. Why are we doing this test? What will we do differently based on what it finds? What are the risks of the procedure itself? What happens if we watch and wait instead? These are not difficult questions. They are not rude questions. They are the right questions. And a good doctor will be glad you asked them. Because the goal of medicine, the real goal, is not to find every abnormality hiding in your body. The goal is to help you live the longest, most comfortable, most independent, most joyful life you possibly can. Sometimes that means doing less. Sometimes the bravest, wisest, most medically sound decision is to say, I've looked at this carefully with my doctor, and we've decided this particular test is not right for me right now. You are not being reckless when you make that choice thoughtfully. You are being smart. You are treating your body with the respect it has earned over 65 or more years of hard work. Before I let you go, let me give you something practical to take with you. If you are over 65, here is what I'd recommend. Make a list of every test and screening you are currently scheduled for. For each one, write down 2 questions. 1, what are we going to do differently based on what this test finds? 2, what are the risks of doing this test or procedure itself? Bring those questions to your next appointment. Don't be shy. Don't be worried about being a difficult patient. The doctors who are truly good at their jobs will respect you more for asking. And if your doctor doesn't have time to answer those questions or dismisses them without explanation, that itself is information you need. Your health is not a factory. You are not on an assembly line. You are a person with your own history, your own values, your own body, and your own definition of what a good life means. Every medical decision should be made with all of that in mind. I want to hear from you now. Leave a comment below and tell me, has one of these tests been something your doctor recommended for you? Have you ever wondered whether a procedure was really necessary? Your experience might help someone else reading these comments. And if this video helped you today, if it gave you something real to think about, please share it with someone you love who is over 65. Your brother, your sister, your neighbor, your friend from church. They deserve to have this information too. And if you want to know the 5 things you should actually be doing every single day after 65 to protect your heart, your kidneys, and your mind without unnecessary tests and without expensive medications, make sure you watch the next video, because that one is going to change how you start every morning. I'll see you there. Take care of yourself. And remember, the wisest patient in the room is the one who asks the best questions. And one more thing before you go. I know some of you watching right now are dealing with something. Maybe you just had a test come back with a finding. Maybe you are worried about a procedure your doctor scheduled. Maybe you are feeling overwhelmed by all of it. I see you. I want you to know something that I believe with everything in me after years of practicing medicine. Fear is not a treatment plan. Panic never healed anyone. What heals people is information, support, good questions, and a doctor who truly listens. If you don't have that last one yet, keep looking. You deserve it. You have lived long enough and worked hard enough and loved enough people to deserve a doctor who treats you like the whole, complex, wise, valuable human being that you are. Don't settle for less. Your life is worth more than a checkbox on a screening form. Now go call someone you love.